Medicare is one of those topics that almost everyone knows of, but very few people truly understand until they're forced to make decisions. And by then, the clock is usually already ticking. This presentation is designed to slow that process down and replace confusion with clarity. Medicare is not a single plan, and it's not as simple as signing up and being done. There are multiple parts, multiple paths, strict enrollment windows, and long term consequences tied to the choices you make, some of which are difficult or impossible to undo later. Many people assume Medicare would just automatically take care of itself when they turn 65. Others believe it works like employer health insurance, and some assume all Medicare plans are basically the same. Unfortunately, none of those assumptions are correct. The reality is that Medicare decisions affect your doctors you can see, how much you pay out of pocket, how prescriptions are covered, how your healthcare costs behave over time. And just like Social Security, Medicare decisions are often easier to get wrong than to fix later. The goal of this session is not to sell anything or push a specific plan. The goal is education. By the end of this presentation, you should understand how Medicare works, what your options are, and how to think through the choices in a way that fits your retirement and healthcare needs. This presentation is especially important if you are approaching age 65, recently retired, or planning to retire in the next few years. Medicare decisions are often connected to employment, Social Security, and retirement income. So understanding the big picture matters. Throughout this presentation, we'll focus on helping you understand the structure of Medicare, the decisions you'll need to make, and the most common mistakes people make when enrolling. This is an educational session. Take your time, pause if needed, and revisit sections as questions come up. Medicare is not something to rush, and informed decisions are always better than default ones. Let's start by talking about why Medicare decisions matter so much in the first place. To really understand Medicare, it helps to first understand why these decisions matter so much. Medicare is not just about having health insurance. It's about how healthcare fits into your retirement years. For most people, healthcare becomes one of the largest ongoing expenses in retirement. While Medicare helps cover many medical costs, it does not eliminate them. Premiums, deductibles, copays, prescriptions, and uncovered services can add up quickly, especially over a long retirement. What makes Medicare different from employer health insurance is that you're responsible for choosing your path. With employer coverage, decisions are often made for you. With Medicare, you must actively select how you want your coverage structured. These decisions influence more than just monthly premiums. They affect how much you pay when you see a doctor, whether you need referrals, which hospitals are covered, and how predictable your healthcare costs will be year to year. Another reason Medicare decisions matter is that some choices create long-term consequences. Certain enrollment decisions are time-sensitive, and missing a window can result in penalties or limited options later on. Many people don't realize that changing Medicare coverage later can be difficult or, in some cases, impossible without medical underwriting. That means the plan you choose initially may follow you for years. Medicare decisions also intersect with other major retirement milestones, such as retiring from work, starting Social Security, or transitioning off employer coverage. When these events aren't coordinated, gaps in coverage or unnecessary costs can occur. Unfortunately, a lot of Medicare decisions are made under pressure. People are busy, paperwork is confusing, and deadlines feel overwhelming. That's often when default decisions are made, not because they're the best option, but because they're the easiest at the moment. The purpose of education is to remove that pressure. When you understand how Medicare works and what your options really are, you can make decisions intentionally instead of reactively. Medicare is not about finding a perfect plan. It's about choosing a structure that fits your health needs, your budget, and your retirement goals, and understanding the trade-offs involved. With that context in mind, the next step is understanding when Medicare starts, who is eligible, and how timing plays a role. One of the most common questions people have about Medicare is simply, when does this actually start? And while the short answer is around age 65, the real answer has a few important details that are easy to miss. For most people, Medicare eligibility begins at age 65. Your initial enrollment period is a 7-month window that includes the 3 months before your 65th birthday, your birthday month, and the 3 months after. That window is extremely important. Enrolling at the right time helps ensure coverage starts when you expect it to and helps you avoid unnecessary penalties. However, Medicare is not automatic for everyone. If you're already receiving Social Security benefits, enrollment in certain parts of Medicare may happen automatically. If you are not receiving Social Security yet, you generally need to actively enroll. Eligibility rules can also differ depending on your situation. Some people qualify for Medicare before age 65 due to disability or specific medical conditions. Others may delay enrollment because they are still working and covered under an employer health plan. This is where timing becomes critical. Delaying Medicare without having qualifying coverage can lead to late enrollment penalties, which can increase your costs permanently. On the other hand, enrolling too early when you're still covered by an employer plan can create overlapping coverage and unnecessary expenses. Another area of confusion is the assumption that Medicare replaces all other coverage automatically. In reality, Medicare often needs to be coordinated with employer coverage, retiree plans, or other insurance, especially during a transition into retirement. It's also important to understand that Medicare enrollment is not just a single decision. Different parts of Medicare have different enrollment rules and timelines, which means you may need to make multiple decisions at different times. The key takeaway from this slide is that when you enroll matters just as much as what you choose. Missing an enrollment window or misunderstanding eligibility rules can create problems that are difficult to fix later. By understanding the basics of when Medicare starts and who is eligible, you can approach enrollment with confidence instead of uncertainty. Next, we'll break down the structure of Medicare itself by looking at the four main parts of Medicare and what each one does. One of the biggest sources of Medicare confusion is the belief that Medicare is a single plan. In reality, Medicare is a system made up of four different parts, each with a specific role. Understanding these four parts is essential because every Medicare decision you make later is built on this structure. The four parts are Part A, Part B, Part C, and Part D. Think of them as building blocks rather than separate, unrelated plans. Medicare Part A is hospital insurance. It generally covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health services. Most people qualify for Part A without paying a monthly premium, but that does not mean it is free. Deductibles and cost sharing still apply. Medicare Part B is medical insurance. This covers doctor visits, outpatient care, preventative services, lab work, durable medical equipment, and many other medically necessary services. Part B does have a monthly premium, and that premium can increase based on income. Medicare Part C, also known as Medicare Advantage, is an alternative way to receive your Medicare benefits. These plans are offered by private insurance companies and bundle Parts A and B together, often including additional benefits. Medicare Part D provides prescription drug coverage. Like Medicare Advantage, Part D plans are offered by private insurers and vary in cost, coverage, and drug formularies. It's important to understand that everyone on Medicare has Part A and Part B as the foundation. From there, you choose how you want to receive your coverage, either by adding supplemental coverage to original Medicare or by enrolling in a Medicare Advantage plan. Each part of Medicare has its own rules, costs, and enrollment timelines. This is why Medicare decisions can feel overwhelming at first. You're not making one decision, you're making several coordinated ones. The goal of this presentation is to help you understand what each part does so you can evaluate your options with clarity instead of confusion. Now that you have the overall structure in mind, we'll take a closer look at each part, starting with Medicare Part A, which covers hospital services. Let's start breaking Medicare down piece by piece, beginning with Medicare Part A, which is often referred to as hospital insurance. Medicare Part A generally covers inpatient hospital stays, care in a skilled nursing facility after a qualifying hospital stay, hospice care, and certain limited home health services. This is the part of Medicare most people think of first because it's tied to major medical events. One reason Part A is frequently misunderstood is because most people do not pay a monthly premium for it. If you worked and paid Medicare taxes for at least 10 years, Part A is usually premium free. Because of that, many people assume Part A is completely free, And that's where problems arise. While there may be no monthly premium, Part A still has deductibles and cost sharing. Each benefit period comes with a hospital deductible, and extended hospital stays can result in daily co-payments. These costs can add up quickly during a serious illness or injury. Another area of confusion is skilled nursing facility coverage. Medicare Part A does not cover long-term custodial care. It only covers skilled nursing care following a qualifying hospital stay. And even then, coverage is limited to a certain number of days. Hospice care is also covered under Part A, which can be an important benefit later in life. However, eligibility and coverage rules still apply, and not all services are fully covered. It's also important to understand what Part A does not cover. It does not cover routine doctor visits, outpatient procedures, or preventative care. Those fall under Part B, which we'll discuss next. For most people, Medicare Part A serves as a foundation for catastrophic coverage, major hospital events that could otherwise be financially devastating. However, because of deductibles and gaps in coverage, Part A alone is rarely sufficient. This is why Medicare planning is about layering coverage appropriately. Part A provides a base, but it needs to be coordinated with other parts of Medicare to manage both access to care and out-of-pocket costs. With that understanding in place, we'll move on to Medicare Part B, which covers everyday medical services and plays a major role in ongoing healthcare costs. Medicare Part B is often referred to as medical insurance, and for most people, this is the part of Medicare they interact with the most on a regular basis. Part B covers services like doctor visits, outpatient procedures, preventative care, lab work, imaging, durable medical equipment, and many other medically necessary services. If it happens outside of a hospital admission, it's usually Part B. Unlike Part A, Part B does require a monthly premium. That premium is typically deducted directly from your Social Security benefit once you're receiving it, or billed to you if you're not yet collecting Social Security. What surprises many people is that the Part B premium is income-based. Higher income individuals may pay more due to income-related monthly adjustment accounts. This means Medicare costs are not the same for everyone, even though the coverage rules are the same. In addition to the monthly premium, Part B also includes an annual deductible and ongoing cost sharing. After the deductible is met, Medicare generally pays a portion of approved charges, and you're responsible for the remainder. Importantly, there is no out-of-pocket maximum under original Medicare's Part A and B. That means there's technically no cap on what you could pay in a bad year if you require extensive medical care. This is where Medicare planning becomes especially important, because Part B covers so many routine and ongoing services. Even modest cost sharing can add up over time, particularly for individuals managing chronic conditions. Another key feature of Part B is preventative care. Many preventative care services are covered at little or no cost, which encourages early detection and routine care. Understanding what is covered can help people take full advantage of these benefits. It's also important to note that enrolling in Part B is not optional for most people once they stop working and lose employer coverage. Delaying Part B without qualifying coverage can lead to permanent penalties, which we'll discuss later. Part B is a critical piece of Medicare, but it's also the reason many people choose additional coverage to help manage costs. Next, we'll talk about what Medicare does not cover, because those gaps play a major role in choosing the right Medicare path. One of the most important and often overlooked aspects of Medicare is understanding what it does not cover. Many people enroll in Medicare believing it will function like comprehensive employer health insurance. Unfortunately, that assumption can lead to unpleasant surprises. First, original Medicare does not have an out-of-pocket maximum. That means there is no annual cap on how much you can spend on deductibles, co-pays, and co-insurance in a year. In a year with significant medical needs, costs can add up quickly. Another major gap involves dental, vision, and hearing care. Routine dental services like cleanings, fillings, and dentures are generally not covered. Routine vision exams, glasses, and contact lenses are also typically excluded. Hearing exams and hearing aids are not covered under original Medicare. These are not small expenses, especially as people age. Yet many people don't realize these services aren't covered until they receive a bill. Medicare also does not cover long-term custodial care. This includes assistance with activities of daily living, such as bathing, dressing, eating, or supervision due to cognitive decline. While Medicare may cover short-term skilled care under very specific conditions, it does not pay for ongoing long-term care. This misunderstanding causes a lot of confusion. People often assume Medicare will step in if long-term care is needed later in life. In reality, long-term care planning is a separate conversation entirely. There are also limitations on coverage outside the United States. In most cases, Medicare does not cover health care received abroad, which can be important for retirees who travel frequently or spend time outside the country. Prescription drugs are another gap. Original Medicare Parts A and B do not provide comprehensive outpatient prescription coverage, which is why Part D or other coverage options are necessary. The reason these gaps matter is because Medicare planning is not just about enrolling. It's about deciding how to manage what Medicare doesn't cover. This is where additional coverage options come into play. Understanding these limitations doesn't mean Medicare is inadequate. It means Medicare was designed as a foundation, not a complete solution on its own. In the next section, we'll explore one way people address these gaps by looking at Medicare Supplement or Medigap plans. One way many people choose to manage the gaps in original Medicare is through Medicare Supplement plans, often referred to as Medigap. Medigap plans are designed to work alongside original Medicare, meaning Medicare Parts A and B remain your primary coverage. Medicare pays its portion first, and then the Medigap plan helps cover some or all the remaining out-of-pocket costs, depending on the plan. These out-of-pocket costs can include deductibles, co-payments, and co-insurance, the expenses that can otherwise add up quickly under original Medicare. One of the biggest advantages of Medigap plans is predictability. Many people like knowing that once their monthly premium is paid, their medical costs are relatively stable and easier to budget for, even in years when healthcare needs increase. Another important feature of Medigap plans is provider flexibility. In most cases, as long as a doctor or hospital accepts Medicare, they will also accept a Medigap plan. There are typically no networks and no referrals required. Medigap plans are standardized, which means that a plan with the same letter provides the same core benefits regardless of the insurance company offering it. What can differ are premiums, customer service, and rate increase history. It's also important to understand what Medigap plans do not cover. They generally do not include prescription drug coverage, which means a separate Part D plan is usually needed. They also typically do not include dental, vision, or hearing benefits. Enrollment timing matters with Medigap. There is a specific window when you can enroll without medical underwriting. Outside of that window, acceptance may depend on health and coverage is not guaranteed. Medigap plans tend to appeal to people who value choice, predictability, and long-term stability, particularly those who want to limit surprises when it comes to medical expenses. Medigap is not the only path available, however. In the next slide, we'll look at an alternative approach known as Medicare Advantage, which takes a very different approach to coverage. Another common way people receive their Medicare benefits is through Medicare Advantage, also known as Part C. Medicare Advantage plans take a very different approach compared to original Medicare with a supplement. Medicare Advantage plans are offered by private insurance companies that are approved by Medicare. When you enroll in a Medicare Advantage plan, that plan becomes responsible for administering your Medicare Part A and Part B benefits. These plans often bundle coverage together. In addition to hospital and medical coverage, many Medicare Advantage plans include prescription drug coverage, and some also offer extra benefits such as dental, vision, hearing, or wellness programs. One feature that attracts many people to Medicare Advantage is cost structure. Premiums are often lower than Medigap plans, and some plans even advertise a $0 premium. However, it's important to understand that lower premiums do not necessarily mean lower overall costs. Medicare Advantage plans typically operate with networks. This means you may need to see doctors and hospitals within the plan's network to receive the highest level of coverage. Referrals may also be required depending on the plan structure. Another key difference is cost sharing. Medicare Advantage plans usually include co-payments for doctor visits, specialist visits, procedures, and hospital stays. While many plans have an annual out-of-pocket maximum, costs can still add up in years with significant medical needs. These plans are also subject to annual changes. Benefits, provider networks, formularies, and costs can change from year to year. That means coverage that works well one year may look very different the next. Medicare Advantage can work well for individuals who are comfortable with managed care, value additional benefits, and prefer a more bundled approach to coverage. However, it's important to understand that Medicare Advantage is not simply better or worse than original Medicare, it's just different. Each path involves trade offs. To make an informed decision, it's helpful to compare Medicare Advantage directly with Medigap. That's exactly what we'll do next. At this point, you've heard about both Medicare supplement plans or Medigap and Medicare Advantage. This slide is where everything starts to come together because these two options represent two fundamentally different approaches to Medicare. With Medigap, you stay on original Medicare. Medicare pays first, and the supplement helps cover out-of-pocket costs. This approach is often valued for predictability. Monthly premiums may be higher, but medical expenses tend to be more stable and easier to anticipate. Medigap also offers broad provider access. In most cases, you can see any doctor or hospital that accepts Medicare without worrying about networks or referrals. For people who travel frequently, split time between states, or want maximum flexibility, this can be an important consideration. On the other hand, Medicare Advantage takes a managed care approach. The plan replaces original Medicare for day-to-day coverage and operates more like traditional insurance. Premiums are often lower and additional benefits may be included. However, Medicare Advantage typically comes with networks, copays, and annual plan changes. Costs may be lower in healthy years, but higher in years when more care is needed. Provider access can also vary depending on location and network rules. Another key difference is how each option handles long-term predictability. Medigap plans tend to change gradually over time, while Medicare Advantage plans can change significantly from year to year, including doctors, hospitals, drug coverage, and cost sharing. Neither option is inherently right or wrong. The best choice depends on your health, budget, lifestyle, and tolerance for variability. Some people value cost certainty. Others value lower premiums and additional benefits. What's important is understanding that choosing one path often limits access to the other later on. Switching from Medicare Advantage to Medigap in the future may require medical underwriting, depending on timing and location. That's why this decision deserves careful thought. It's not just about today's premium. It's about how you want your healthcare to function over time. With that comparison in mind, we'll move next into prescription drug coverage, which plays a major role regardless of which Medicare path you choose. Prescription drug coverage under Medicare is provided through Medicare Part D, and this is an area where many people get confused, especially because coverage looks very different from employer health insurance. Medicare Part D plans are offered by private insurance companies approved by Medicare. These plans help cover the cost of outpatient prescription drugs, meaning medications you take at home rather than in a hospital or clinical setting. Depending on how you receive your Medicare coverage, Part D may be handled in different ways. If you're on original Medicare with a Medigap plan, you usually enroll in a standalone Part D plan. If you're enrolled in a Medicare Advantage, prescription drug coverage is often included as part of the plan. One of the most important things to understand about Part D is that not all plans cover the same medications. Each plan has a formulary, a list of covered drugs, and those formularies can differ significantly from one plan to another. Plans also categorize drugs into tiers, which affects how much you pay. Even if two plans cover the same medication, the cost to you may be very different depending on how that drug is classified. In addition to premiums, Part D plans may include deductibles, co-payments, or co-insurance. These costs can change as you move through different phases of drug coverage throughout the year. Another important consideration is that Part D plans change annually. Formularies, pharmacies, premiums, and cost sharing can all be updated each year. A plan that works well one year may not be the best option the next. This is why reviewing prescription coverage regularly is so important. Staying on the same plan year after year without review can result in higher costs or reduced coverage. It's also worth noting that delaying Part D enrollment without having qualifying drug coverage can result in late enrollment penalties, which are added to your premium permanently. Prescription coverage is a key component of Medicare planning because medications often become more important and more expensive over time. In the next section, we'll walk through Medicare enrollment periods because timing plays a critical role in when and how you can choose coverage. Medicare enrollment is not open all the time. Instead, it operates within specific enrollment periods, and understanding these timelines is essential to avoiding penalties, coverage gaps, or limited options. The first and most important enrollment window is the initial enrollment period, often called IEP. This is a 7-month window surrounding your 65th birthday, 3 months before, the month of your birthday, and 3 months after. Enrolling during this period helps ensure your Medicare coverage begins when you expect it to and helps you avoid late enrollment penalties. Missing this window without qualifying coverage can create long-term consequences. The next type of enrollment window is the Special Enrollment Period, or SEP. This applies to individuals who delay Medicare because they are still working and covered by a qualifying employer health. When that employer coverage ends, either due to retirement or job loss, a special enrollment period allows you to enroll in Medicare without penalty, as long as you act within the allowed time frame. This is where coordination with the employer coverage becomes extremely important. Another key enrollment window is the annual enrollment period, which occurs every year from October 15th through December 7th. During this time, individuals can make changes to Medicare Advantage plans or prescription drug coverage. It's important to understand that not all Medicare decisions can be made during the annual enrollment period. Some changes are limited, and others may require medical underwriting depending on the type of coverage. There is also a Medicare Advantage open enrollment period early each year that allows certain limited changes for those already enrolled in Medicare Advantage. The reason enrollment periods matter so much is because Medicare does not generally allow late changes outside these windows. Missing a deadline can mean waiting months for coverage or facing penalties that last for life. Many people assume Medicare works like employer insurance, where changes can be made anytime. In reality, Medicare operates more like Social Security. Timing is everything. Understanding these enrollment periods gives you control. Instead of reacting to deadlines, you can plan ahead and make decisions calmly and intentionally. Next, we'll talk about late enrollment penalties, which are one of the biggest risks when Medicare enrollment is misunderstood. One of the biggest risks in Medicare planning is late enrollment penalties. These penalties exist to encourage timely enrollment, but they often catch people off guard, especially those who assume they can sign up later without consequences. Medicare penalties are not the same for every part of Medicare. Each part has its own rules, and understanding the differences is important. Medicare Part B has one of the most significant penalties. If you delay enrolling in Part B without having qualifying employer coverage, your premium can increase by 10% for every 12-month period you are eligible but not enrolled. That increase is typically permanent, meaning you pay it for as long as you have Part B. Medicare Part D also has a late enrollment penalty. If you go without credible prescription drug coverage for more than a certain period, Medicare adds a penalty to your Part D premium. Like the Part B penalty, this is generally permanent. What makes these penalties especially frustrating is that they often result from misunderstandings, not intentional decisions. People may think they're covered when they're not, or they may not realize employer coverage rules have changed. Another common issue is assuming that COBRA or retiree coverage automatically counts as credible coverage for Medicare. In some cases, it does, but in others, it does not, and the distinction matters. Penalties are not just about higher premiums. Delaying enrollment can also lead to gaps in coverage, which can expose people to unexpected medical expenses. The key takeaway here is that Medicare penalties are avoidable, but only if enrollment is handled correctly and on time. Once penalties are applied, they are very difficult to reverse. This is why Medicare planning should begin before you turn 65 or before you retire. Waiting until the last minute increases the risk of mistakes. Understanding penalties isn't about creating fear. It's about empowering you to protect yourself from unnecessary costs. Next, we'll talk about how Medicare works alongside employer coverage, which is one of the most common sources of confusion. One of the most confusing areas of Medicare planning is how Medicare works alongside employer health coverage. This is especially important for people who are still working past age 65 or who are covered under a spouse's employer plan. The first thing to understand is that Medicare does not automatically replace employer insurance when you turn 65. In many cases, the two can work together, but the rules depend heavily on the size of the employer. If you or your spouse work for an employer with 20 or more employees, that employer plan is generally considered primary and Medicare is secondary. In those situations, many people choose to delay enrolling in Part B without penalty, as long as the employer coverage is considered credible. If the employer has fewer than 20 employees, Medicare usually becomes the primary payer once you are eligible. In that case, failing to enroll in Medicare on time can result in denied claims, penalties, or unexpected out-of-pocket costs. This distinction is critical, yet many people are never told about it. They assume that if they're working and have insurance, they're automatically safe to delay Medicare. Unfortunately, that's not always true. Another area of confusion involves spousal coverage. If you are covered under your spouse's employer plan, the same employer size rules apply. Understanding who pays first helps avoid coverage gaps and billing issues. COBRA coverage is another common trap. While COBRA allows you to continue employer coverage for a period of time, it does not always protect you from Medicare penalties. In many cases, Medicare should be enrolled in first, with COBRA acting as secondary coverage. Retiree health plans can also complicate things. Some retiree plans require Medicare enrollment to continue coverage, while others coordinate benefits differently. The details matter. The key takeaway here is that employer coverage and Medicare must be actively coordinated. Assuming they will automatically work together can lead to costly mistakes. Before retiring or making changes to employer coverage, it's important to understand how Medicare fits into that transition. A little planning can prevent a lot of frustration. Next, we'll talk about Medicare costs, including premiums, deductibles, and out-of-pocket expenses, so you can better understand what to expect financially. One of the most important things to understand about Medicare is that while it helps manage healthcare costs, it does not eliminate them. Medicare comes with its own set of premiums, deductibles, co-pays, and coinsurance, and those costs can change over time. Let's start with premiums. Most people do not pay a premium for Medicare Part A, but Medicare Part B does require a monthly premium. That premium is typically deducted from your Social Security benefit. And for higher income individuals, it can be increased based on income. In addition to Part B, there may be premiums for Medicare Advantage plans, Medigap plans, and Part D prescription drug coverage, depending on which path you choose. This means many retirees have multiple healthcare-related premiums each month. Next are deductibles. Medicare Part A has a deductible for each benefit period, and Part B has an annual deductible. Prescription drug plans may also have their own deductibles before coverage fully kicks in. After deductibles are met, co-pays and coinsurance come into play. Under original Medicare, Part B typically covers a percentage of approved charges, and you're responsible for the remainder. With Medicare Advantage, co-pays are often required for doctor visits, specialists, hospital stays, and procedures. One key difference between Medicare paths is how predictable these costs are. With Medigap, many out-of-pocket expenses are covered, creating more consistent costs from year to year. With Medicare Advantage, costs may be lower in healthy years, but higher in years when more care is needed. Another important consideration is that Medicare costs are not static. Premiums, deductibles, and co-pays can increase over time, and plans can change their cost structures annually. This is why Medicare planning is not a one-time event. It requires periodic review to ensure coverage still aligns with your health needs and budget. Understanding Medicare costs helps set realistic expectations. Medicare can significantly reduce healthcare expenses compared to being uninsured. but it still requires thoughtful planning to avoid surprises. In the next slide, we'll discuss how to choose the right Medicare path based on your health, budget, and lifestyle preferences. Now that we've covered how Medicare works, the different coverage options, and the associated costs, the natural question becomes, how do you choose the right Medicare path? The most important thing to understand is there is no single best Medicare option for everyone. The right choice depends on a combination of factors, and those factors are different for each person. One key consideration is your health. Someone who sees doctors frequently or manages ongoing medical conditions may value predictability and broader provider access. Someone who is generally healthy and comfortable with managed care may prioritize lower premiums and bundled benefits. Another factor is budget and cash flow. Some people prefer paying higher monthly premiums in exchange for more stable out-of-pocket costs. Others are comfortable with lower premiums and variable costs, knowing expenses may fluctuate from year to year. Lifestyle also plays a role. If you travel frequently, live in multiple states, or want maximum flexibility in choosing providers, certain Medicare paths may align better than others. If you're comfortable staying within a defined network and value convenience, a different approach may make sense. It's also important to consider long-term planning, not just your current situation. Health can change, and the ability to switch coverage later may be limited. Thinking ahead can help avoid future frustration. Another common mistake is focusing solely on monthly premiums. While premiums are important, they're only one piece of the puzzle. Total cost, access to care, and predictability all matter. Choosing the right Medicare path is about trade-offs. Every option gives you something and asks you to give up something. The goal is to choose the set of trade-offs that best fits your priorities. When people understand how Medicare options differ and what matters most to them, the decision becomes less overwhelming and more intentional. In the next slide, we'll look at common Medicare mistakes, not to create fear, but to help you recognize issues to avoid as you move forward. By now, you could probably see that most Medicare problems don't happen because people are careless. They happen because Medicare is confusing, deadlines are rigid, and the rules are not always clearly explained. One of the most common mistakes is waiting too long to enroll. People assume Medicare will be automatic, or they believe they're covered through work without verifying whether that coverage is considered creditable. Missing an enrollment window can lead to penalties or gaps in coverage that are difficult to fix later. Another frequent mistake is choosing a plan based only on the monthly premium. While premiums are important, they don't tell the full story. Lower premiums may come with higher copays, restricted provider networks, or greater exposure to out-of-pocket costs during a bad health year. A related issue is underestimating how health needs can change. A plan that works well today may not work as well in the future. This is why thinking beyond the first year of Medicare is so important. Many people also make the mistake of never reviewing their coverage after enrolling. Medicare Advantage plans and Part D plans can change every year, including costs, provider networks, and drug coverage. Staying on autopilot can result in higher costs or reduced access to care. Another common oversight is misunderstanding how Medicare works with other coverage, such as employer plans, retiree benefits, or COBRA. Assuming these coverages automatically protect you from penalties can lead to expensive surprises. Some people also delay getting help because they're worried about being sold something. As a result, they rely on incomplete information from ads, mailers, or quick conversations rather than getting clarity tailored to their situation. The purpose of highlighting these mistakes isn't to create fear, it's to help you recognize where people tend to run into trouble so you can avoid those pitfalls. Medicare works best when decisions are made intentionally, with an understanding of both the rules and the long-term impact. Education is the best protection against regret. Next, we'll step back and look at how Medicare fits into your broader retirement plan, because healthcare decisions don't exist in isolation. One of the most important things to understand about Medicare is that it does not exist in a vacuum. Medicare is not just a healthcare decision, it is a retirement planning decision. For many retirees, healthcare is one of the largest and most unpredictable expenses they will face over time. Medicare plays a major role in managing those costs. but how you structure your coverage can influence your overall retirement cash flow. Monthly premiums, out-of-pocket costs, prescription expenses, and potential future healthcare needs all factor into how much income you need in retirement. Choosing the right Medicare path can help create stability and reduce financial stress. Medicare decisions also intersect with Social Security timing, retirement account withdrawals, and tax planning. For example, healthcare premiums and medical expenses may influence how much income you need to draw from savings each year. Another important consideration is longevity. Retirement is lasting longer than many people expect, and healthcare needs often increase with age. Planning Medicare coverage with a long-term mindset helps ensure you're prepared not just for the first few years of retirement, but for the decades that may follow. Medicare can also influence flexibility. Some coverage structures offer more predictable costs, while others trade predictability for lower upfront premiums. Understanding how those trade-offs affect your overall plan is key. When Medicare is coordinated properly with the rest of your retirement plan, it can reduce pressure on the other assets and help preserve flexibility during market downturns or unexpected events. The goal isn't to eliminate healthcare costs. That's not realistic. The goal is to manage them intentionally in a way that supports your broader retirement objectives. When Medicare is treated as part of the plan instead of an afterthought, people tend to feel more confident and less anxious about the future. In the next slide, we'll summarize the key takeaways to keep in mind before enrolling in Medicare so you can move forward with clarity. As we begin to wrap up, it's helpful to step back and highlight a few key takeaways that apply to almost everyone approaching Medicare. First, Medicare is not automatic for everyone. While some people are enrolled automatically, many must actively sign up, and knowing when and how to enroll is critical to avoiding penalties or coverage gaps. Second, timing matters. Medicare operates on strict enrollment windows, and missing one can lead to permanent penalties or limited options later. Planning ahead rather than reacting at the last minute gives you far more control. Third, Medicare is not a single plan. It's a system with multiple parts and multiple paths. Understanding the differences between original Medicare with a supplement and Medicare Advantage helps you choose coverage that fits your health needs, budget, and lifestyle. Another important takeaway is that coordination matters. Medicare decisions affect and are affected by employer coverage, retirement timing, Social Security, and overall cash flow. Looking at Medicare in isolation often leads to suboptimal results. It's also important to remember that the lowest premium is not always the lowest cost. Predictability, provider access, and long-term flexibility are just as important as monthly price. Education is what turns Medicare from a source of stress into a manageable decision. When you understand how the system works and what trade-offs you're making, you can move forward with confidence. Medicare doesn't require perfection. It requires understanding. And understanding comes from taking the time to learn before enrolling. In our final slide, we'll talk about next steps and how to reach out if you have questions or would like help reviewing your options. If you're watching this presentation on your own time, that tells me something important. You want to understand your options before making decisions that can affect your healthcare and finances for years to come. Medicare is not something you need to figure out in one sitting, and it's not something you should feel rushed into. The purpose of this presentation was to give you a clear foundation so you can approach Medicare decisions with confidence instead of confusion. Every situation is different. Your health, your medications, your budget, your lifestyle, and whether you're still working all play a role in determining which Medicare path makes the most sense. That's why general information can only go so far. If you have questions after watching this, or if you'd like a second opinion on your Medicare options, the next step is simple. You can reach out using the contact information on the screen. You're welcome to email us with questions, or you can schedule a call at a time that works best for you. There's no obligation and no pressure, just a conversation focused on helping you understand how Medicare applies to your situation. For some people, that conversation confirms they're already on the right track. For others, it helps clarify trade-offs or identify issues they hadn't considered yet. Either outcome is valuable. Medicare decisions don't have to be overwhelming. With the right information and the right guidance, they become manageable and intentional. Thank you for taking the time to watch this presentation. If and when you're ready, we're here as a resource to help you move forward with clarity and confidence.